Hello everyone, I am Dr. Sourabh Kumar Jain, neurosurgeon in the Medicity Hospital, Rudrapur. So today's topic of discussion is understanding epilepsy and its myth. So what is epilepsy? Epilepsy is a medical condition where a person has recurring unprovoked seizures. Epilepsy can affect anyone at any age. Early diagnosis and treatment of epilepsy can control seizures and prevent potentially life-threatening complications. Medication can stop seizures in about 50 to 70% of patients. What causes epilepsy? So some are the reasons like developmental abnormalities in the brain, infection that injures the brain like meningitis or encephalitis, lack of oxygen to the brain like hypoxic insult, disturbance in blood circulation to the brain like in stroke or vasospasm or vascular problems, tumor of the brain, previous trauma, and genetic causes. Now come to the symptoms of epilepsy. So the most visible sign of epilepsy is seizure. Seizure usually lasts for seconds to several minutes. There are many types of seizure. Some are severe, some are less severe or subtle. People having a seizure might not be able to respond to others. They may not remember the seizures. Sometimes a seizure will be widespread. So there might be convulsions, brief staring spells, repetitive automatic behaviors such as swing movements, and decreased awareness of what is going on. Now come to the myths of epilepsies. First is epilepsy is contagious. But the fact is, epilepsy is not like a cold or flu. You can catch it from someone who has it. Approximately 75% of all cases have no known cause. Of the remaining 25% causes may include developmental abnormality, birth injuries, head or brain trauma, strokes, or tumors. Another myth is epilepsy is a form of mental illness. The fact is, although some epileptics may also have a mental illness, there is no direct link between the two. Another myth is you can swallow your tongue during an epileptic seizures, but the fact is, this is potentially one of the most dangerous epilepsy myths. It is not actually possible to swallow your own tongue and putting something into the mouth of a person having a seizure or stop her from swallowing her tongue could block her airway. Another myth is epileptics are typically or less than average intelligence. But the fact is epilepsy is not an indicator of intelligence. Another myth, only children suffer from epilepsy, but the fact is epilepsy knows no age, sex, or religion. But young and old suffer from epilepsy, and it is not peculiar to children. Another myth is people with epilepsy cannot lead a normal life. But the fact is, person with epilepsy can lead normal life, can marry, and have children. Another myth is epilepsy has no cure and cannot be treated. But the fact is that is already discussed. 50 to 70% of patients can be controlled through anti-epileptic medicine or if surgery if indicated. And that's it. Thank you.